Hey y'all, what's good, what's poppin', what's happening, how y'all doing? If you're new, my name is Joy. If you're returning, you already know what it is, okay? So today's video, as you can tell from the title, is going to be dental assistant pros and cons. My name is Joy. I am 24 years old. I've been a dental assistant since 2020. I graduated from a dental program, got my certificate. I do not have my RDA because I'm in a state that does not require or does not have a registered testing. However, when I was a DA working in California, I technically did not need it. So yeah, based on the duties I was doing. So I felt the need to make this video because I feel like dental is a good, or can be a good, beneficial program to get into. It can be a good place to start. It can be a good place to start when you are fresh out of high school, or just trying to figure out, you know, what you want to do, but you want to be in the medical field, but you're not too sure. So I just made some pros and cons while I was at work. That way it can kind of help me, you know, with this video. And this is just overall based off of my 2 years of experience, almost 3 years of experience, and then just things that I felt were important to me. So we're gonna start off with the cons. We're gonna do the bad first. So working on Saturdays isn't like extremely bad. It's not like, you know, the end of the world, but it definitely depends on the office that you're at. My first office was the general office, and working Saturdays was 6:45 to 2. Some days I absolutely woke up and wanted to call out, without a doubt. Whereas other offices, it might be a 8 to 1, a 7 to 2. It really just depends on the office, but depending on the time for a Saturday, you kind of just feel like your whole day is gone. And then sometimes you work 2 Saturdays a month, sometimes you may work 1 Saturday a month. It really just depends. And then not busy or working at a productive office. For me, I like to keep busy. I want time to fly by. I want to be productive and get things done. So working at an office that's not a fast-paced environment, and I'm not saying like we're rushing through patients, but it's a good steady flow to where like you feel like you're working and not like you're bored, because I don't like to be bored. I don't like to feel bored at all in general. You know, I like that there's downtime at work so you can, you know, restock or just do certain things, but like, you know, kind of just standing around not having nothing to do, it's cool here and there, but not on a consistent basis. Next would be a doctor that doesn't care, and or a doctor that's overly involved. So I have worked for a doctor that didn't care, and she kind of just was, I guess, seemed bothered or irritated when patients have questions, because there was one point where she did roll her eyes when a patient did ask a question. But working for a doctor that doesn't care and is just in it for the money is not a good environment to be in, and it's not a doctor you would want to work for, honestly, from my personal experience. And then a doctor that's overly involved. When I say this in the context where the office that I work at now, I don't know if it's because I have acrylic nails, but it's an orthodontist office, and he likes to untie the patients. And I don't know, because I like ortho, I like to untie and tie. Like, that's what's fun. That's like, you know, what's fun about doing ortho. So it's like, if I don't get to do that, then like, why am I here? Like, you're gonna talk to them, you're gonna talk to the patient, you're gonna untie them, and he ties back in. Like, it's like a waste of my time, me being here, if you're gonna do the work. Besides that, like, being overly involved, I guess, just not knowing when to like stop talking and go see your next patient, because now we're running behind and then you're upset at us, but you know, it's the doctor that is creating the issue. And then I would say a doctor that's very traditional, that kind of does things by the book or does things their way, where the office isn't challenging or wanting to grow. I feel like for me as a person, I like environments that are challenging and allow me to grow. So being somewhere that is very stagnant or very comfortable or in a routine doesn't work for me, but it might work for somebody else. But that's a con for me, because although dentistry is very traditional, I feel like there's always new things to learn and new ways to do things, or easier way to do things, efficient ways to do things. So that's just my personal preference. But I also find that a lot of doctors don't, because they have that doctorate title, that they don't listen to their assistants. They kind of just, you know, have a superiority complex because they can't. And then difficult patients or parents. We're all gonna have difficult patients and or parents. However, you have to just kind of navigate with them and be patient, and you know, take your deep breaths, woosah anytime you can or you get the chance to, so that you don't take your frustration out on them. And then not growing as a DA, you can't really move up in this field, or being a dental assistant. I mean, the only really step up you can do is like a lead dental assistant, and sometimes that doesn't even necessarily pay you more money, depending on where you're at, where you're working at, what office. And you can honestly only go to just like a different specialty. That's really about it. And so with only being able to go to different specialties, once you switch to a new specialty, you are like starting all over. You're starting from the bottom because you're new in this specialty. So that is my cons for working as a dental assistant with almost 3 years of experience. So my cons list is a little bit longer than my pros, but we're gonna get into the pros. So the pros for being a dental assistant: a set schedule. I absolutely enjoy consistency and a routine in my own life. So having a set schedule so I can plan my life around things. I know that I have these days off to be able to, you know, live my life. Absolutely love that. Busy and productive. I enjoy staying productive, staying busy, staying active, getting things done. So I like a productive office. Time off, holidays, vacation is the next one. With having a set schedule, you're gonna get time off. So of course, you know, being able to take off, because the office pretty much has a set schedule. This isn't like a hospital or somewhere that's open like 7 days a week. Now there are dentist offices out there that are 7 days a week. So for the offices that are 7 days a week, I mean, that kind of sucks. But you know, being able to take off or have certain holidays off is nice. There are certain holidays you don't get off as a dental assistant because we kind of work around people's school and work schedule. So there are certain holidays where you will have to work because kids and or adults will be off of work. So it just depends on the office. And then just being able to take a vacation is nice, you know, if there's enough staff in the office to be able to do that. I would say the pay is moderate. You know, it's a decent pace to starting off your career, depending on what office you work at, what you're doing, what specialty you're in. But I think just for, I don't know, I would honestly say like the pay is decent, but it could be better. Dental assistants are overworked and underpaid, and people do not value us. We are like the co-pilot to the dentist, and there are dentists that don't know where things are in their office. They don't know how to operate without their dental assistants, and there's just a certain flow to the office when you have dental assistants that care, that are involved and are proactive. And then I put moderate to like intermediate work. Like the work, being a dental assistant, I don't think that the work is too difficult, but I also don't think that it's challenging either. Because once you kind of get to know what you're doing and what's going on, it gets easier. So it's not like super hard. Like the only thing I can really compare it to is like being a nurse. Like there's a lot that goes into being a nurse, whereas like in the dental field, I feel like there's a lot that goes into it, but depending on the specialty that you're in can depend on your level of skill set. And then pros, connections, and networking. I am a person that likes to engage with people in terms of talking, having conversation, getting to know people, getting to know my patients, what they're doing. So, and because I'm only 24, I feel like there's so many other career options out there. I like to talk to patients and or parents and ask them like, what do they do for a living? Just different questions. Like before I had moved out of state, I had asked a lot of the patients and some of my coworkers like, what's something you wish you had did in your 20s? So like think of creative questions to ask, you know, people to help you network, to help you elevate in your own life, that may spark a conversation or interest or something that you want to be doing, or, you know, elevate whatever your side activities are, different things like that. And then, so that was it for my pros list. Honestly, my overall advice for somebody that is wanting to be a dental assistant and if it's worth it, I would say I think that it is worth it if you want to get into the medical field. But don't stay stuck being a dental assistant. Continue to pursue more, whether you go up to the front desk or you go back to school to do hygiene, or if you want to do sterilization tech, you can do sterilization at a hospital, or, you know, start with this and then work your way up to be a sonographer or x-ray tech. Like, don't just stay being a dental assistant unless you find an office that you really enjoy and you like and you want to grow with them. So some, you know, important factors for me as a dental assistant is office setting and environment. I like a positive work environment, somewhere that's like fun, bubbly, exciting, great to work with, funny, because your coworkers are what make your experience. The work you do it's just work, but like the environment that you in really plays a part in how you feel and how you show up to work. And then the doctor, you want somebody that cares about you, your well-being, and then it cares about their patients and what they're doing, and they're not just in it for the money. And then I have coworkers in music, you know, positive coworkers, and, you know, a genuine connection with at least one or two coworkers. I would say one because I've always had one at, you know, the offices that I've worked at. but your coworkers literally make your work environment. And then music, like you want some upbeat, you know, exciting, positive, you know, music to keep you going through the day, because if it's too relaxed where it's like spa music, it's boring, it's not personable, it's not exciting, it's not inviting either. So that is it for today's video. I really hope you guys like this, enjoyed this. Please give me a thumbs up, comment, and subscribe. Let me know if you're starting your dental assisting journey, if you already are a dental assistant, your thoughts, your experiences. I love to hear what you guys have going on. So again, thank you guys so much for watching this video. I really appreciate you, and wishing you well on your dental assisting journey.